Hello everyone, I'm AI assistant at Ask Surgeon Shamim platform. If you or a loved one has surgery scheduled, you might be feeling anxious about how to prepare. That's completely normal. Every year, millions of people undergo surgery. And here's something important. Proper preparation can reduce complications by up to 30% and speed up your recovery by 15 to 25%. In the next 10 minutes, I'm going to walk you through a complete 7-day preparation timeline, plus critical 24-hour checklist items. By the end of this video, you'll know exactly what to do each day leading up to your surgery. Let's get you prepared and confident. First, let's talk about why preparation is so important. Number 1, fewer complications. Studies show that patients who follow preoperative guidelines experience up to 30% fewer complications. This includes reduced infection rates, better wound healing, and fewer anesthesia-related issues. Number 2, faster recovery. When you arrive at surgery in optimal condition, your body is better equipped to heal. Patients who prepare properly typically have shorter hospital stays and quicker returns to normal activities. Number 3, peace of mind. Knowing you've done everything right reduces anxiety. You'll walk into that operating room feeling prepared and confident. The good news? Preparation is simple when you follow a systematic checklist. So let's break it down day by day. 7 days before surgery, this is when you handle all the paperwork. Essential documents. Government-issued photo ID. Insurance card and policy information. Pre-authorization approval from your insurance. Any referral letters from other doctors. Recent medical records and test results. List of your current medications. Emergency contact information. Make copies of everything and keep them in one folder. You'll need these when you check in for surgery. 6 days before surgery, it's time for a comprehensive medication review. Some medications need to be stopped before surgery, while others should be continued. Here's what you need to know. Medications to stop, usually 5 to 7 days before. Blood thinners like aspirin, warfarin, or Plavix. Anti-inflammatory drugs like ibuprofen or naproxen. Herbal supplements, ginseng, garlic, ginkgo, these can increase bleeding risk. Medications to continue, with a small sip of water on surgery day. Blood pressure medications. Heart medications. Thyroid medications. Here's something critical. If you have diabetes, you'll need special instructions about your insulin or diabetic medications. Work closely with your surgeon and primary doctor on this. Never stop your diabetes medications without explicit instructions. Create a complete list of all your medications, including dosages and frequency, and bring it to your pre-surgical appointment. 5 to 4 days before surgery, focus on nutrition and light physical activity. Dietary goals. Increase protein, aim for lean meats, fish, eggs, legumes. Protein supports healing. High-fiber foods, whole grains, vegetables, fruits prevent constipation after surgery. Stay hydrated, 8 to 10 glasses of water daily. Vitamin C-rich foods, citrus fruits, berries support your immune system. Foods to avoid. Heavy, greasy, or fried foods. Excessive alcohol, none at all 48 hours before surgery. Highly processed foods. Light exercise. This might surprise you, but staying active before surgery is beneficial. Take 20 to 30-minute walks daily. Do gentle stretching. Practice deep breathing exercises. Avoid strenuous exercise or contact sports 48 hours before surgery. And always follow specific instructions from your surgeon. 3 to 2 days before surgery, organize your support system and complete preoperative tests. Support arrangements. Transportation. Someone must drive you home. You cannot drive yourself after anesthesia, even for outpatient procedures. Caregiver, ideally, have someone stay with you for 24 to 48 hours after surgery. Childcare, arrange care for children and pets. Work leave, notify your employer and get medical leave documentation. Meal prep, prepare or arrange easy-to-reheat meals. Preoperative tests. Your doctor may order. Blood tests. EKG. Chest X-ray. Other tests based on your health and surgery type. Complete these tests on schedule. Delays can postpone your surgery. Stay tuned and continue for the final preparation in part 2 of this video.
Hello everyone. This is part 2 of our video, How to Prepare for Surgery. The day before surgery, final preparations are crucial. Personal care, shower thoroughly, use antibacterial soap if your surgeon provided it. Remove nail polish. Medical staff need to see your nail beds to monitor oxygen levels. No makeup, lotion, deodorant, or perfume. These interfere with monitoring equipment. Remove all jewelry, including piercings. If you can't remove your wedding ring, it may be taped. Contact lenses, remove them and bring glasses instead. Pack your hospital bag, government ID, and insurance cards. List of medications. Comfortable, loose-fitting clothes for going home. Slip-on shoes. Glasses if you wear them. Phone charger. Any comfort items. Get everything ready tonight. You don't want to be searching for things in the morning when you're already anxious. Now, let's talk about the critical 24-hour period before surgery. Fasting instructions. This is critical. Fasting prevents a life-threatening complication called aspiration, where stomach contents enter your lungs during anesthesia. Standard fasting times. Solid foods and heavy meals. Stop 8 hours before. Light snacks. Stop 6 hours before. Clear liquids. Stop 2 hours before. Chewing gum and candy. Stop 8 hours before. Alcohol and smoking. Stop 24 hours before. Critical. Follow these times exactly. If you eat or drink within the restricted time, your surgery will be postponed. If you accidentally consume something, tell your surgical team immediately. Don't hide this information. Special note for diabetic patients, you'll receive modified instructions for your insulin or medications during the fasting period. Never adjust your diabetes medications on your own. Surgery morning, take approved medications with a small sip of water. Shower with antibacterial soap. Do not eat or drink anything. Do not apply lotions, makeup, or deodorant. Remove all jewelry and piercings. Wear comfortable, loose clothing. Arrive at designated time. Let me walk you through what happens when you arrive. Check-in. You'll check in at the surgical admissions desk. Verify all your documents and insurance. Complete any final paperwork. Preoperative area. Change into a hospital gown. Your belongings will be stored or given to your family member. An intravenous line will be started. Nurses will check your vital signs. You'll meet your anesthesiologist. Ask any final questions. Your surgeon will visit to review the procedure. When it's time, you'll be taken to the operating room. The anesthesia team will make you comfortable and you'll fall asleep quickly. You won't remember anything until you wake up in the recovery room. Your family will receive updates, and once you're awake and stable, they can see you. Before we wrap up, here are a few bonus tips. Home preparation. Set up a recovery area with everything within easy reach. Remove tripping hazards. Place a pillow in the car for the ride home. Questions to ask. Don't leave your pre-op appointment without understanding exactly what time to stop eating and drinking. Which medications to take the morning of surgery. What to expect for pain management. When you can return to normal activities. Mental preparation. Practice deep breathing exercises. Visualize a successful surgery and recovery. Remember, your surgical team does this every day and is highly skilled. Preparing for surgery doesn't have to be overwhelming. Follow this 7-day checklist and you'll be as ready as possible. Remember, Day 7, documents and insurance. Day 6, medication review. Days 5 to 4, optimize nutrition and fitness. Days 3 to 2, arrange support and complete tests. Day 1, final personal preparations and pack. Day 0, follow fasting instructions exactly. You've got this. Proper preparation gives you control over what you can control, and that reduces anxiety significantly. If you found this video helpful, please give it a thumbs up and subscribe for more evidence-based medical guidance. Share it with anyone who has surgery coming up. Read our full blog and download our complete checklist in the description below. I'm AI assistant at Ask Surgeon Shamim platform. Wishing you a smooth surgery and speedy recovery. Stay healthy and stay informed.